Hello and welcome to
OPod.
OPod. Today we'll be discussing women's mental health and we are joined by Dr. Kate Adlington.
Thank you for speaking with us today about women's mental health, specifically women's perinatal mental health. Could you tell us a bit more about yourself and what it is that you do?
Yeah, of course. Well, thank you very much for asking me, first of all. So I'm, as you said, I'm Dr. Kate Adlington. I'm a doctor and I'm training in General Adult Psychiatry. And my particular area of interest is mental health in the perinatal period. So basically that's pregnant women and the first year after giving birth. So mental health during that time. So I work in that area in East London. And I also do a bit of research in that as well.
We have a couple of questions on cards, so don't get distracted by them. They're pretty brief, so feel free to add as you go. There's not a script on this.
No worries.
First question is, what are some lifestyle choices that you recommend for a healthy pregnancy, and is an unhealthy pregnancy linked to poor mental health?
Cool. So really good question to start off with. And I think it's really important to say that it's never too early to start thinking about healthy choices. So before you're even considering pregnancy, obviously it's good to think about making healthy lifestyle choices. But one of the things we definitely say is if you are planning a pregnancy, that's a good time to start looking at your lifestyle, looking at some certain factors, partly because that can both increase your chance of getting pregnant in the first place, but can also kind of ensure that you have a healthy pregnancy and a healthy baby. So some of the key things that kind of we recommend thinking about is if you smoke, trying to certainly cut down and hope to eventually stop. And we know that's really difficult. So getting some support with that early before you are pregnant is probably a really good idea. Also, things like drinking, alcohol. Again, the advice when you're pregnant is to not drink. So again, trying to think about that early and cutting down. I think just generally kind of things that we think about throughout your life, getting regular exercise, kind of doing things in your life that keep you kind of happy and active are really important. And doing that early is, before you're pregnant, making those changes early is important. I think another thing that is recommended before you get pregnant is thinking about your diet and certain supplements. So taking folate supplements, so folic acid supplements is something you can get over the counter. And usually it's sort of 3 months before you're pregnant is ideal. But just to say, obviously, lots of pregnancies aren't planned, and that's
I was going to say the exact same thing. I was like, if you didn't obviously want to get pregnant, and then it happens, and you're like, okay, I didn't have that 3 months to prepare myself.
Totally, and I think actually, I think it's nearly half pregnancies aren't fully planned. So, just again, it's sort of never too early to make healthy choices, but it's never too late either. So once you know you're pregnant, again, it's thinking about those things. So if you're smoking, trying to stop, drinking, trying to cut that out. And the good thing is support with things like that. So seeing your GP, and there are local services that are really targeted at pregnant women to help with things like that. Also going to a local pharmacist and asking them kind of what supplements there are, kind of what's the best kind of, as I said, folic acid supplement. And, there's lots of stuff online as well that can give you advice. So whilst we say kind of see your GP, that's a good kind of point. We know sometimes it is quite difficult to get an appointment. So looking online, NHS website has got loads of good advice about kind of lifestyle choices. As I said, supplements, support groups, things like that. One of the things I did want to mention, because obviously mental health is my thing, is one of the really important things is if you have existing difficulties with your mental health, and particularly say if you're taking medication, that's one of the big questions that comes up is, if I'm pregnant, should I stop taking medications? And that's true for mental health or other physical health problems. So that's why it's a good idea to kind of check in before you get pregnant, because you can get some advice about things like that. What things can you do to kind of optimize your mental health, your physical health before you get pregnant, but also really importantly some advice around medication, so that because often you don't need to stop your medication, but sometimes people, once they get pregnant, they suddenly worry and they might suddenly stop them, and actually that might be the worst thing to do. So it's good to get some advice around that.
Yeah, it's good that Google exists, because I tend to use Google for almost everything. And the NHS websites are really useful when it comes to medical issues. And yes, it's not always easy to get in contact with your GP or go to the doctor.
No, I was going to say about that. And I know people can kind of complain about Dr. Google, and you can kind of go down like rabbit holes, and it can be scary. So that's why it's really good to try and stick to kind of like accepted websites. So usually there is the NHS one, but they usually do also signpost to other kind of accepted, like there are loads of really good charity websites as well that give advice. So I'm thinking Tommy's is a good website that gives advice about planning for pregnancy.
Do you know if there are like, any like apps or something? Because obviously a lot of people on their phones nowadays, and there's a lot of communities.
Yeah.
Do you know any like maybe?
I do know there's an NHS app.
That's it.
Yeah, that and from there they do signpost. There are kind of pregnancy kind of pregnancy planning apps and ones that you can use. There are lots of ones that people use during pregnancy. I like. Sometimes they're paid ones, some you can get free. I probably wouldn't recommend any in particular, but not to use, but there's none that I would say are better than any of the others, but they are useful. So yeah, definitely.
So the next question is, what are some of the medical health issues that affect women in pregnancy during the first year, and how are they treated?
Yeah. Kind of mental health complications are probably one of the most common complications of pregnancy, which I think lots of people aren't aware of. And I think if we think about it, that some people might find that surprising, because I don't know, in society I think there's this sense that kind of pregnancy and becoming a new mom, it's meant to be like the happiest time. Yeah, it's like, why isn't everyone jumping for joy? It's the best time. But I think the reality is actually both pregnancy and becoming a new parent in general is really hard actually, and can be really hard. So some people have great pregnancies and it's all, perfectly fine, and that's brilliant. But actually being pregnant, you can feel really rubbish, especially the first trimester, sickness, tiredness. Can bring up lots of emotional stuff for people, kind of thinking about becoming a parent themselves, particularly if maybe they've had difficult experience of parenting themselves. Once baby's here, no sleep, struggles to feed. Do you breastfeed? Do you not? What do you do? The mum guilt, which, is really present. So there's loads of challenges. And so it's sort of no wonder that actually people can struggle both emotionally, but also to the point that they actually develop kind of mental health problems. And depression is, so we talk about perinatal depression. So that's kind of depression. People can develop it in pregnancy. About 1 in 6 women, or after birth is kind of more common. So, and we're not really sure why. There are lots of theories.
Include like postpartum?
Exactly. So that's exactly it. So about 20% of women who give birth will experience depression, kind of especially in that first 3 months. We don't know why. There are kind of lots of theories. Is it hormones? Could it just be like the social changes? We're not sure, but it's common. And it's different too. So you also hear people talking about baby blues. So that's like in the first maybe few days, 3-4 days, it's actually even about 50% of women suddenly feel, very tearful, very low, very kind of overwhelmed.
I think I actually saw that on TikTok. There was a trend, and there was like these women all posting their baby blues and like crying over their babies, and I was like, what's going on?
Yeah. So it's really common, and actually again it's a recognized thing, but the way that's different from depression is it usually lifts quite quickly. So it's like a day or two, and then you start to feel yourself again, whereas depression is sort of low mood, really low energy, just not getting any enjoyment out of things. It's sort of the difference with also the postpartum, this new is often there are kind of feelings towards, you feel very guilty towards baby, you feel very sad about, and it can be related to feelings to baby as well, but it sort of persists. So it goes on for at least 2 weeks, maybe longer. So it is common. But I think the problem is that because there's this expectation about, it being a really happy time, everyone should be jumping for joy, there's a lot of stigma around it. So I think a lot of women don't
feel the
talk.
Pressure.
Yeah, they feel the pressure. They don't talk about it. They just sort of put on a brave face, and they don't get themselves help. And I think that's why it's really important for us to talk about it and for people to talk about it, because it is common, and it's okay to feel, it's okay to feel like that, but it's also okay to reach out for support. Just to say as well, there are other mental health kind of problems that can pop up at that time as well. So anxiety is another one. Actually, there's something called perinatal OCD. So there's around kind of the time of giving birth and having a new baby, some women do actually develop OCD for the first time. I don't know if you've...
Oh, is that similar to nesting, or is it separate?
It's slightly different. So it's obsessive compulsive disorder. So it's where people will maybe start to obsess about certain things. So have very intrusive thoughts about things like maybe baby's cleanliness. So they'll get really worried that maybe baby's getting kind of dirty or the health of baby, and they'll get these really intrusive thoughts, and then they'll do things to try and kind of make themselves feel better. So clean baby a lot, or like keep cleaning the house to make sure there's nothing that's going to infect baby. And it just becomes a really, really stressful for them, and really kind of intrusive and upsetting. So that's more rare, but it's just to kind of say that things like that can crop up. It's just this is a really important time when, because of all the changes that happen and we're not sure why, these mental health problems can happen. So it's really important to talk about it, because there is treatment out there, and women can get help.
On the topic of some mothers having OCD with a new baby, I completely understand that, because babies are born with no immune system, so you definitely want to keep everything clean, and some parents might overdo it and get really stressed about that. So I can understand where that anxiety may come from.
Yeah. And I think that's one of the things that's is important, kind of, because I think people worry about seeing they worry about seeing doctors, but they definitely worry about seeing mental health professionals, because they worry that is this normal? Is it not? Is it gonna? And actually, part of our job sometimes is to say, do you know what, this is with, that those are valid concerns. That is valid worry, and actually you're okay. There is support. You don't, this isn't, a mental health disorder. But sometimes those worries do get kind of overblown, and they do get carried away, and they start to affect your life. So. And you do need, women need, or people need support with them. So that's, part of it. Sometimes it's just reassurance that people need, and just to say, actually, you're doing really well, and that's a valid concern. But sometimes it's say, actually, it seems like this has got
when it's affecting
now.
your life.
Exactly, and it's gone, exactly, it's stopping you from going out, or, you're cleaning your house for hours and hours every day, and you don't want to be. So, but luckily there is treatment and help, so... Yeah.
Related to that, we wanted to ask, when you don't have a good support network, parenting is especially hard, what support is available in the first year for parents?
Yeah, so I think that's one of the really key things, is kind of one of the things that can help with your mental health and kind of help even the transition to parenting is having social support, and a lack of social support is associated with kind of developing mental health conditions. So and I think that's one of the things, actually preparing early in pregnancy, being aware that actually it can be tough. You're going to need people around you. And, not everyone has a partner, not everyone has family. So there are other ways you can get, support. And it's both emotional support. So it's kind of having people you can just vent to and talk to, but also practical support. Like, you sometimes want to nip out to the shop, and there's someone there to look after baby, just for an hour a day or an hour a week, So I think... thinking about what the source of support are, I think kind of from a kind of, I guess, medical perspective, we think about, the support you have in the early days. Midwives are really important. So in those early days, you usually see a midwife every kind of in the first day or week or two, you'll see them. And they will have a really good sort of font of knowledge for local services and local kind of support groups or classes or children's centres or feeding support that they can give to you, and then that you can then use kind of going forward. So they're kind of,
Sorry, I wanted to ask, so how early in your pregnancy, or like for how far along can you get a midwife? Like in the process with it? Like,
so it varies a little bit, but kind of standardly, your first appointment with a midwife is your booking appointment. So that's when you're usually about about 8 to 10 weeks before 12 weeks. Usually, if you know you're pregnant at that stage, you either contact your GP, or lots of kind of hospitals, maternity services, you can actually just refer yourself. So as soon as you've done a pregnancy test, you can contact them and say, I'm pregnant, and they'll offer you an appointment with a midwife. And from that point, there's sort of a really kind of a schedule of midwife appointments throughout your pregnancy. It depends a little bit whether it's your first or second, but there's that. Then you have your first scan at 12 weeks. Then you might have another appointment at 16 weeks and so on. And so that's really good because at each of those, the midwife, there's kind of lots of physical health stuff around your pregnancy, but they also kind of check in with you around kind of how you're preparing, you know, how you're doing. And there is like emotional, you know, checking in, but also they start to introduce kind of ideas about kind of what's happening locally for you once you've got baby, kind of what services there are, what support's available. And they also, I think this is kind of from my perspective, they're like often the first port of call around your mental health. So if people are struggling with that, women are struggling with that in pregnancy, they're the ones who usually ask about it in those appointments. It's not always the same midwife. It depends kind of on the hospital. So sometimes you are seeing a different person each time. And there are different thoughts on that. Some women kind of like the idea of seeing the same person, but sometimes it's just not possible. And then after you've given birth, there's another schedule. So you usually see a midwife like on day, you see them in hospital if you give birth in hospital, or if it's at home, like day 1, and I think it's like day 3, day 5. So they're quite intensively involved in those first kind of week or 2, which again is really good because that's, you know, if women are starting to struggle at that point, they can kind of check in and refer you on, both just for general support in the community, but also kind of for more specific mental health support. But the other person I was going to say, people who are really good for that as well, is the health visitor. So all women see a health visitor. They come to see you in the first couple of weeks at home after you've given birth. And again, their job is definitely like the kind of contact point with your community for kind of like community support. So they'll check in with you, check in with baby, they weigh baby, they check in with how feeding's going, things like that. But they also have really good resources around who can you see in the community if you're struggling with feeding, or what are the local support groups. Say if you're a single mum, you know, are there any special support groups specifically for that, or you know, where can you go and get baby weighed, things like that. So it's kind of, you don't just feel left, like,
With all the changes that come with pregnancy, what advice do you give to parents to help them to adjust to the first year?
One of the big ones is what I've said just before about is it's not, you know, it can be really hard, and don't worry if it is, because that's normal. And don't, you know, the most important thing is if you are finding it hard is that you feel able to talk about it and tell people. So that's really important. And reach out, kind of find your network, find people who are there to support you. You know, look out for local mums groups, or you know, kind of social groups that you can get involved with, because those, you kind of, it's almost like find your tribe, because it is a massive change. You know, people they sometimes get a bit disconnected from their old networks. You know, you stop working, you know, which is a big thing, both in terms of identity, but also kind of losing that financial, you know, support, again, particularly if you're a single parent. But even if you have a partner, you know, as a woman, if you stop working, that can feel, you know, make you feel quite vulnerable. So just having that support group is really important, I think. And things like social media actually are really, so go on Instagram and just look to see if there are any kind of local, just kind of local mums who are kind of chatting about what's going on. I live in Waltham actually, and there's an Instagram account called E17 Baby, which I would never have followed before I had a baby. I had one, and actually it's really useful because she kind of posts about loads of different stuff that's going on in the community, kind of ways to check in, you know, groups, health, you know, things related to your health, but also things related to social. So for me, I think that's really important. I would say that because my area of interest of research was around loneliness, in like around that period, and kind of how that links to perinatal depression. So for me, I think that's really important. So I think my main advice is around that, kind of thinking about kind of thinking about you as a kind of individual and your needs, kind of your, you know, what your social support is. And I think the other thing, which I didn't say, was that's also around that kind of feeling the pressure of being a new mother. There's this kind of theory in psychology about being a good enough mother. And I think people put a lot of pressure on themselves as parents to kind of get everything right, everything to be perfect.
I think it's even harder now because social media, so many people are showing off like their perfect babies and their perfect motherhood, and it's kind of like, I'm not doing as well as she is. So it's like that big, like, it's like oh, I'm looking for help, but at the same time I'm seeing people doing better than me. So it is a thing of like, I don't feel like I'm good enough.
I think that's a really good point, actually, because saying look on there for support, but actually you have to look quite hard to find the kind of real support, like, instead of the shiny. So actually, right, that's probably not for social media. It probably isn't the best for everyone.
I feel like it's a 50-50.
Yeah, but it can work, but yeah, and it is just that it's like, actually sometimes just being good enough is fine, and you're your own worst critic. That's true. Your baby won't know if you've chosen exactly the right, you haven't dressed them in the perfect outfit, or you haven't gone to every single baby group going, or you doing just enough for them is absolutely fine. And just finding your feet. People often say, like, don't leave the house for the first 2 weeks. I think there's this pressure to get out there doing stuff, and it's really hard. So kind of giving yourself time, bedding into it, but at the same time, having some contact with the outside world and having some support is really important.
So similar to that, I guess, on the topic of suicide is the most common cause of death during the first year of perinatal. So the work you do is essential. Can you speak more on it?
Yeah, of course. And I thank you for asking that, because it's a really tough topic, and people often, talking about suicide in young mums and pregnancy is really hard, but I think it's not well known that suicide is the leading cause of death. So in the year after birth, it's really surprising, but unfortunately it is the case. And it is obviously linked to the fact that, mental health, these perinatal mental health problems do happen, and they are common. So basically there's a report that gets published every year. It's called the Embrace Report, where they look at all deaths of women in pregnancy and in the first year, just to look at the causes, and try and think kind of, it shouldn't happen, but what is happening and why is it happening? And that's how we know that suicide is common. It happens in pregnancy, but particularly in the postpartum year. Or that first year after birth, and we also know that substance misuse is so drug overdoses and alcohol use is a cause of kind of a number of deaths as well. So from a mental health perspective, we there's this kind of public health reason to think about mental health, try and support women, because it can lead to death, but it can also, it's not just it can lead to impacts on these women's quality of life. It can impact on their their relationships, their relationship with baby as well. It kind of impacts, their ability to kind of interact with baby. So it's really important that we address women's mental health, both to try and stop these deaths by suicide, but also to try and improve people's lives. Just to say as well, on looking at kind of this report that looks at deaths, importantly as well, it has highlighted that deaths in that perinatal period are much higher in Black women and women from ethnic minorities. So there's a really good campaign called 5 Times More, run by 2 women from the Black community. That it was called 5 Times More because when they started it, the data showed that Black women were 5 times more likely to die. The more recent report, it's 4 times more likely, but it's still obviously, it's
still too high.
Yeah, way too high. And I think that's why we have to think about mental health within that, because mental health is a big cause of death during that period. We know that Black and ethnic minority women are more likely to experience mental health problems. They're less likely to seek support in the community during this period. And when they do seek support, they're more likely to be go into hospital. So what we know is that, there are things we can do in mental health that improve Black women and ethnic minority women's experiences, that can hopefully address, try and improve that unacceptable death rate and unacceptable kind of, I guess, experience of services. So I think that's kind of an important thing that has come out of that report, but that we need to think about and improve, definitely.
Is the advice and support different for young mums and single parents than they would be for parents that are married or parents that have both guardians, the mother and the father? And would they need extra support for adjusting to motherhood?
Yeah, so the advice probably, it obviously depends, it's different for every person, but I think we know that both kind of young mothers, so whether that's teenage or before the age of 25, and single parents, they have kind of worse outcomes for mental health. And they're all these things that we talk about, challenges for any parent, those challenges I think are worse in those situations because you're less likely to probably have peers who are in the same situation just by nature of the fact there are fewer people having babies at that point. So it's harder to find kind of your tribe. There are fewer people like that. So you've kind of got less social support. You have generally got less support, perhaps because if you don't have a partner, that just makes it slightly harder. Things like financial situation is probably just a little bit kind of less steady. You've had less time to kind of maybe build up, a kind of income. You might be in the education system, and then that becomes a bit kind of more difficult to figure out kind of what you're going to do. So, and we also know that young mums and single parents are more likely to experience domestic abuse as well. So for lots of different reasons, there are just all those challenges that are already there are just kind of more, you're facing more at that point. So I think there's even more reason why you would benefit from kind of social support or groups, but actually I think the provision is worse. I think actually that it's quite patchy support, looking for support specifically for young mums and single parents. It's things that are particularly designed for those people. It is slightly patchy. So I definitely think it's an area we need more research and there needs to be more provision. But certainly it's something that if you're going to maternity services, it will get flagged up. So they will always, in maternity service, when you're seeing your midwife, they will ask you if you've got a partner. And it will get flagged up, not in a bad way if you don't, but often those services will have, maybe special streams or special advice for women who are, who are single. And similarly, often there are actually kind of special kind of clinics, for example, for younger mums, or there'll be special midwives for younger mums because they do have unique challenges and they will know kind of how to refer to services that are there for them. But I think it's an area that perhaps there does need to be more research and that there needs to be more provision. Because I was looking before I came, I was trying to look for kind of charities that are out there that specifically support, for example, like teenage mums or younger mums, and there isn't a lot out there actually, and kind of existing charities. So things like there's the National Childbirth Trust, so NCT. They do mention, they'll have pages that mention younger mums and younger mums' experiences, but there's not much out there that's specifically kind of like really focused on this. So I think it's an area that needs kind of more investment and more research, definitely, yeah.
So following from that, the next question is, can you inform us of the services and classes that are available to support new parents during and post-pregnancy? We kind of covered it a little bit, but if there's any things that you have to add.
So I guess I didn't talk about antenatal classes. So antenatal classes are classes that you can attend in pregnancy. Lots of maternity services do their own kind of NHS ones that are usually free, and it might be like a day that you can go along to the hospital and they'll talk about things like, often they're really focused on kind of preparing for birth, probably rightly, because I think that's a big anxiety in pregnancy is labour and giving birth.
I'm trying to think about it because of that specific section.
It's a massive it's a huge thing, and lots of women are, and kind of talk about mental health. So, for some women it's so it's such a fear, it is a phobia. There is such a thing as phobia of childbirth, which is understandable, because when we look at it on the television, it's screaming, it's blood, it's and there are risks associated with childbirth, but thankfully in this country we have really good health care system, and in the vast majority of cases babies are born safely and women are okay, but you know there can be complications, and so it's really good that there's lots of education before, that women know their choices, they know how to prepare, they go into it kind of fully aware. So that's a big part of antenatal classes. And I said NHS do some of those classes, but lots of people also do private classes. So I think I mentioned the National Childbirth Trust, so people could talk about NCT classes because they run these antenatal classes. The thing about them is they are actually quite expensive, so I think and lots of women do, or lots of family, you know, couples or women use them to kind of find other women who are having babies around the same time, to kind of make kind of little friendship groups. So you have your babies at a similar time, you hang out afterwards. But because they're very expensive, often I think that can, you know,
deter
for people exactly, so people who can't afford it, they're kind of almost kind of locked out of that a little bit. So luckily there are NHS classes as well that are free, but there is a bit of a disparity there. But so that's one thing that's important kind of in preparing. But after birth, there are, I think I mentioned a couple of times, there are kind of children's centres. So every local area will have a children's centre where you can go. They often do things like weighing clinics, so you can go along and weigh baby, but they'll also run kind of mum and baby sessions. There'll be play groups, and they can tell you about kind of play groups locally where you can go, you know, often for free, to kind of hang out with other mums. You know, again, there are lots of things, like lots of like yoga centres now run kind of mum and baby yoga, or, you know, singing classes, nursery rhyme classes, or reading classes with babies. So things like that are kind of good, you know, social support. Again, because I kind of focus more on the mental health side of things, you know, if people are struggling from that perspective, usually the first port of call is the GP. And actually the GP you see kind of at 6 or 8 weeks for a check with baby anyway. And it's also meant to be, so it's meant to be a check for baby, but it's also meant to be a check for the mum to make sure everything's okay, and check in kind of physically, but also emotionally and with their mental health. So the GP can also kind of, if you're, you know, struggling with your mental health at that point, suggest sources of support in the community. So there are kind of psychology services if, you know, you feel like you need someone to talk to at that point. But there are also specialist perinatal mental health services. So that's a, you know, place that people like me, so psychiatrists or mental health professionals, will work. So if things are kind of feeling a bit worse and you need a bit of kind of specialist input, they can offer things, again, psychological support from kind of social workers if needed, support from psychiatrists or other doctors. So they're there and they work in the community as well. So they're a really important source of support, and that people know about them. And I mentioned the GP, but you can actually, often lots of these services, you can refer yourself. So it's worth kind of, if you feel like you're struggling, just Googling kind of perinatal mental health services, just to see what's available locally as well.
So mental health can really take a toll when you're dealing with multiple births, such as triplets and twins. If there's complications during pregnancy and after pregnancy, is there any support for parents going through that situation, and how can they cope with that?
Yeah, and I having had not had multiple births, but having had kind of recently, I've had 2 children. I've got a 3-year-old and a 6-month-old. I honestly, the thought of having 2 at the same time, I cannot imagine. So it's got its own very unique challenges. And I think anyway, when you're pregnant with multiples, like twins or triplets, there can be more kind of physical health complications. You're more likely to have interventions like cesareans or whatever. So it's just a different experience, and, you know, there are different challenges. Usually, again, maternity services have their own, you know, they're very experienced in dealing with it, but they might, you know, they'll have their own pathways for those women, and kind of have their own kind of sources of support as well. Things like antenatal classes, often there might be special kind of groups, you know, even in pregnancy, where women can go and be with other mums who are also having twins. So they're kind of meeting other women who are in the same situation. And again, kind of those unique challenges, you know, it might be, they can still seek support, through perinatal mental health services or through the GP, they will be able to refer them on. And I think, again, kind of online kind of support through charities, places like National Childbirth Trust, and the NHS websites, they will have specific kind of support and advice for those. You also mentioned that kind of if people have difficulties or complications. So, and I think I touched a little bit on childbirth and trauma, and I think that is a big thing we're beginning to think a bit more about. I think in the past it was just like, you have a difficult birth and that's just it, stiff upper lip, you get on with it. But I think women who do have traumatic childbirth, it can happen that it's very long, or they've needed an emergency C-section, cesarean, or it's just been one of the kind of the biggest things that women say who say they've had a traumatic birth. Often it's just that things were happening and it wasn't communicated to them, or they expected one thing and something different happened. So it's not just one type, but it's often about the woman's experience. If they felt it was traumatic and they felt out of control, or they felt things were done to them without their permission, they can go away afterwards really feeling very traumatized. And we're increasingly kind of recognizing that can then affect their mental health going forward. So we talk about PTSD, so post-traumatic stress disorder, is something often in the past people think about, people have gone to war or things like that, but it's actually if you felt like your life is in danger, anything where you felt like your life is in danger. So often women might meet this criteria of PTSD after childbirth just because it was really frightening for them and they didn't know what was going on, and was a very traumatic experience. So there are starting to be new services in the community that really focus on women who've experienced trauma. So whether it's in childbirth or maybe even trauma in the past that has kind of almost been reawakened by the experience of becoming a mother. So there are new services that are starting that have really only in the first 1 or 2 or 3 years have started to kind of be set up to really help those women. So it's good to know about them. And again, those ones that you could probably, I think lots of them you can refer yourself. And it's usually talking therapy. So it's sitting down and talking to someone about your experience can help women. But it's important just to be aware of that. And that is another thing that kind of can affect women kind of after birth.
So mental health in pregnancy can affect the non-birthing parent too. What mental health issues have you seen in men, and are they supported?
Yeah, and again, another really good question. And I think it's another area that has been quite neglected, and we're starting to have more awareness that actually it's an issue and we need to think about, because we do see and often it's fathers, but you're right, we talk about the non-birthing partner because there can be, all types of partner. We see, lesbian couples, gay men obviously becoming parents through adoption or surrogacy. Increasingly, trans men will start to go through the pregnancy experience, and I think we're way behind even thinking about language and provision for that. So, and we've been talking a lot about women and pregnancy and breastfeeding, but increasingly we do need to think about kind of trans health, trans health issues in pregnancy and afterwards, and using the right language. So specifically thinking about perinatal mental health. So we talk about perinatal depression. Certainly non-birthing partners can be diagnosed with perinatal depression, postnatal depression. So fathers, female partners, because although sort of there are very specific biological changes for the woman, we've also talked about all the social changes that happen becoming a parent, and they happen to both parents if they're, all parents. So, the non-birthing partner will also have changes in their networks, their social structures, their, just kind of, they may have had trauma or difficulties in their own background, in their own parenting, and they get faced with it having their own child. So yes, they, absolutely, they can also experience these mental health difficulties that are very specific to becoming a new parent. And we're only just really thinking about that now. And the NHS has actually said we need to think about that. We need to start offering services.
So there aren't any at the moment?
Well, okay. I think starting to. So some perinatal mental health teams, for example, will be trying to offer support for partners as well. We'll offer, say, psychology sessions maybe with partners, but not all of them will accept referrals specifically for the non-birthing partners. I think it's very variable around the country. There are, again, online, there are some online support groups. If you look, I think, I can't remember the name of it now, but there's, I think there's Postnatal Fathers or something. There, if you look online, you can find, but again, it's quite patchy. There was something I found, and this obviously touches on LGBTQI plus issues of parenting. There's Pink Parents, I think, is an online website that kind of addresses parenting needs in that community. But again, we're really behind the curve, I think, and it's becoming an area where there's more research and more thought about. But I definitely think there needs to be more provision because these issues, mental health issues, do support the non-birthing, affect the non-birthing partner as well, parent. And there are lots of different kind of parenting systems, and I think increasingly we can think about the network around the baby with different parents, different kind of, grandparents are hugely involved, communities, people in the community. It takes a village
to raise a child, is that what they say?
Exactly, exactly, completely. So, and we're kind of, I think we're stuck a little bit in that quite kind of heteronormative mum, dad kind of system in the NHS, which is important because it serves some people, but it doesn't serve everyone. And we need to think about how we can be more inclusive.
Thank you so much for joining us today, Dr. Kate Adlington, on women's perinatal mental health.
Thank you so much for having me.
Thank you guys for watching, and if you found this interesting, we have 2 more episodes coming out on mental health too, so please tune in, and thank you for coming to see us at OPOD.
Bye.